Hi, I'm Dr. Ryan coming at you from the Chiropractic Spa today. Today we're actually going to talk about the scalene muscles. So there's the group of muscles. You have your anterior, middle, and posterior scalenes. And they attach really to the spine at level C2 through C7. And then they attach onto the first ribs and areas really right through here. So the scalenes are really small muscles. They can cause a lot of issues though. One of the things that they're responsible for is actually neck flexion. So as we live in our environment, our heads tend to migrate forward, and then these scalene muscles become taut or tighter. Then as we're under stress, we quit breathing with our belly, we start breathing with our chest and breathing up. So they are also an accessory breathing muscle. They're not as good at functioning for that purpose as the diaphragm is. The diaphragm is built for it, but the scalenes really only help to create a gap vertically for air to come into the lungs, and there's not a lot of space up in the top of the lungs. So they're not efficient, but they do it, right? And so when we start using them for projects they're not designed for, then we have other issues. One of the things that can be caused is actually what we call thoracic outlet syndrome. So if you ever get that numbness or tingling in the arm or hands, some of that actually could be coming right here from right above the collarbone. And it's because the brachial plexus that exits through the neck and controls the nerves of the hand actually get pinched off and impeded by tight scalene muscles. So I'm going to give you a quick stretch. It's kind of funky, but highly, highly effective. So what you do, and I always recommend, get on skin. So get some tissue pull. You're going to find your collarbone right there. Then you're going to go just below it and pull down. So I'm taking my skin, pulling down. Then I'm going to look away and extend my head. And apparently my scalenes are really tight because I feel that. Now, this is where it gets funky and kind of fun. And so, yeah, probably do this one at stoplights so people will really give you a good look. So we're gonna extend and look up. And then once you get there, you purse your lips forward, and that really accentuates that stretch through there. Much more effective than actual muscle stripping. That's no fun. If you want to get a massage in there, that really can hurt, but it's highly effective, really helps and brings down some of that pain. And I'm seeing this more and more recently as people are more stressed out with work and what's going on in the world, and people are just getting really tight up here. So great exercise, great way to loosen those up and reduce the strain.